This is a skull I wanted to show you, and I've actually took a little bit of my son's Play-Doh, hopefully he'll forgive me, to illustrate. This horse has a overpowering upper molars. You can see how long they are compared to the back, and these bottom molars have been pretty much destroyed. This one broke away, and these are worn down excessively. Now, I put the Play-Doh here to illustrate the gum tissue. In a horse, this would actually have gum tissue there, and this overlong rostoral hook would be cutting in to the gum each time this horse tried to make a chewing motion. This horse also came from a rescue and was in pretty bad shape when it got there. So you can see what this tooth wants to do. I'll just hold it there for a second to let you have a nice good look at that. And this, again, went undetected. This horse is in its early 20s, about late teens, early 20s, and this should never have gotten that bad, but unfortunately, it obviously never had access to, I don't know if this horse ever had dentistry in its life. It doesn't look like it. So this is a mare, and you can see what that tooth would do to the gum tissue in a normal horse. So I just wanted to illustrate how bad that can actually be as far as from a pain standpoint. Now I just want to show you a couple other skulls. This one here. I want to zoom in on this real quickly. This has a little decay going on here, and you can see that little pocket there and here. Fortunately, today we have the ability to do composite fillings. Horses like this, they can be drilled out and that can be filled. So some years ago that just wasn't possible, but nowadays we can actually do fillings, and in this DVD there's a section where I show the process of a filling being performed. And you can see this skull here is very uneven, very overgrown here. Has a wave complex. Where the tooth is overgrown, the opposing tooth is always excessively worn out. You can see that one there is very low because this one was excessively long. So if you can keep them balanced from a very young age, we don't need to get to these bad scenarios. The idea is to get them started at the age of 2, have them done every 6 months preferably. Some people who don't do much competitive riding, once a horse gets over 5 years old, you may get away with it a little bit longer than every 6 months, possibly 8 months to a year, depending on each individual horse wears a little different. It's suggested every 6 months just so you don't ever have any major problems, especially when they're young. Up till 5 is critical that they're done every 6 months, but once they're 5 and up, a lot of times they can go a little bit longer, but never more than a year. Absolutely, that should never go past that. That's part of the problem, I think, with horse dentistry. It's out of sight and it's out of mind. There could be a huge problem going on, and the owner of the horse, it's not brought to their attention until the horse is losing weight, it's fighting the bit, it's doing something to alarm the owner. What I'd like to see is that people just go ahead and get their horse's teeth done, just like they get their horse's feet trimmed or shod every 6 to 8 weeks, and they get the vaccines done on a yearly basis. Worming on every 2 to 3 months, they have their horses wormed. The teeth should be on a similar schedule. Every 6 months, at the maximum once a year, but preferably every 6 months. And that just isn't the case. It's not the case right now. But the purpose of this DVD is to educate horse owners so they can think about that and adding that to their normal routine maintenance. I want to talk a little bit about the ability to masticate food, and we'll do that in just a minute. I'm going to talk about masticating the horse's feed. Now, when a horse processes this food, ideally they want to bring the particle size down small enough so they can digest it with not a lot of difficulty. As the teeth deteriorate, and I showed you some examples of wave complexes and just teeth that were not able to chew food properly. This horse here has excessive transverse ridges. This is the one I worked on earlier when I did the actual demo of how the motorized tools work. The ridges would actually interfere with the normal chewing cycle. And the hay basically works into the mouth. See if I can come into the back. I've never really done this before. And it's going to chew the food like this. If you want to just zoom into real close to that. And then what happens is the horse will switch it over from one side to the next and chew the food. And the food gets broken down to smaller and smaller particles, and it brings it down further back, chewing the food, and further back. Eventually, it'll have the food chewed down to a fine particle size, and then it will swallow the food. Now, these teeth, on this side at least, have been done properly, and these have not. The more worn out the teeth become, the more this angle, the angle on the teeth here, the steeper it gets, it actually interrupts with the normal chewing cycle. And that basically takes away from the horse's ability to chew. This angle here is really important. If it's steep, they have to lift up early because they can't do a sweep across this way. So they can sweep across and do a proper chewing stroke. If the angle gets steep, they have to lift up early, therefore they can't get a proper chewing stroke and they can't break the food down properly. So it's not only leveling out the ridges, but it's also maintaining this occlusal angle here, upper and lower, so they meet perfectly. There's also balancing. Whenever you do any molar reduction, you want the pressure on the TMJ, the molars, and the incisors to be equally shared. So if I come around on this side, if there was a major correction done on these teeth, I should probably show you this side because this is the side I worked on. If there was a major correction done and these molars weren't meeting properly, what we do is we shorten the incisors to bring the molars closer together. Sometimes you have to take off quite a bit on the molars because the abnormality is so severe that it takes quite a bit of reduction to correct it. Well, that's okay. When we do the incisor reduction, that allows the molars to come closer together and everything is balanced at three-way pressure equally shared. So that's why we do our incisor reductions, is to help balance the mouth. Hello again. I wanted to explain to you the root cause of these wave complexes. Now, for these teeth to become this unbalanced, from once being like this over here, let me explain to you the actual reason for that. I mentioned to you that the horse has teeth that are deeply embedded inside the jawbone, and that these teeth are moving down very slowly. As they're wearing away, they're moving down. And these teeth are also moving up. What happens is when you get a wave complex like I showed you on that older horse, the teeth aren't all the same strength. If you have a wave complex on the lower molars, as you see here, all that means is these teeth are stronger than the opposing teeth. So that as they're chewing over many years, this is a 25-year-old horse that took that long to get this bad. They're basically, these teeth as they're coming up, are wearing away the opposing teeth. So if we can do occlusal surface correction, take these things down in the early stages when they're not severe, this never needs to happen. So the whole idea of balancing this mouth is to stop the horse getting this severe. Again, this is a pretty dramatic example, but it does happen. I see horses this bad probably half a dozen times a year, this severe, but there's a lot of scenarios that are between this and mild. Obviously it varies, but that's basically what's happening. You've got all these 6 teeth moving up and these 6 teeth coming down, and they're grinding against each other, and you could actually have these teeth file floated with knocking off the sharp points every year for this horse's entire life. It would still end up like this, because if you're only filing the points on the upper molars, the sharp points that most people think about, you haven't done anything for this occlusal surface on the bottom, nor have you done anything on the occlusal surface on top. And that's the thing with dentistry, it's kind of a mystery to most people. They just assume that if someone's rasping up there that they're addressing all the problems, and in reality that's usually not happening. So that's why I'm trying to make you the person with the fine eye as far as scrutinizing who works in your horse's teeth. Again, filing the points would not stop a horse getting this bad. It would still become wave complex if you only did that. Now, if someone was proficient with a file and they knew how to do occlusal surface work in addition to points, then the horse would stay fine. The problem with that is there are very, very few people that know how to use files properly. There are some that are excellent, but the bulk of the people that are filing, they're usually just filing off the sharp points and not really doing proper occlusal surface work. So that is basically why this happens. It's just one tooth being stronger than the opposing tooth, and eventually the opposing tooth just gets worn down and you get that uneven surface.